helping the injured at the scene of a crash. If you come upon the scene of a motor vehicle crash, you may need to help the injured people. Medical care is not likely to reach them quickly and may not reach them at all. This video will show how you and other bystanders can help the injured people. Think first about safety, your own and the injured people. Is there fire, downed power lines, unsafe road conditions, or any other obvious danger? Call for help, but stay back until help arrives if the situation is not safe. Organize with other bystanders. Choose a leader and several people to help. Find someone to bring materials and transport the injured people. Old sheets, towels, clothing, sticks, and cardboard can be used to make neck collars and splints. Now, check the injured people. A man is conscious and in pain. A second man is unconscious. There is a pregnant woman pinned under the bike. Care for the unconscious person first. Immobilize the neck. To avoid further injury, immobilize the neck of anyone found unconscious and involved in high-risk trauma. For example, a crash, a long fall, or a blast injury. The neck should not move at all. If you don't have a neck collar, make one with materials you find. Here, the team uses the injured man's shoes. A shoe is positioned on either side of his head and secured with a cloth tie across the forehead. Also, immobilize the neck of any injured people who have severe neck pain or difficulty moving or feeling the arms or legs. To keep this man's neck from moving, 2 rolled towels are used on either side of his head and secured with a cloth tie across the forehead and the chin. Make a stretcher. To carry an injured person, a stretcher can be made from a few poles and a large cloth or several jackets strung together. The log roll. A maneuver called a log roll is used to move an injured person safely if you need to immobilize their neck or spine. Use 4 people if possible. The person at the head leads the team. He keeps the man's head and neck in line by placing a hand on each side of his neck collar and holding it in place. The 2 people rolling the man overlap their hands to hold his body securely. When the team is ready, the leader says 1, 2, 3, roll. The people rolling the body work together so that the spine stays in line. The 4th person slides the stretcher under the edge of the man. With another command, 1, 2, 3, roll, the man is returned to his back. He may be slightly off-center, so in a coordinated movement, all of the people move the man together. Immobilize a fracture. Fractures are common after a fall or road accident. Suspect a fracture if the injured person is in pain and doesn't want to move her limb. Then, make a splint to keep the injured limb from moving. A simple splint can be made with sticks or cardboard and strips of cloth. Include the joints above and below the injury, in this case, the ankle and the knee. Pad the limb, then position the sticks on each side. Hold the splint in place with ties. Position a pregnant woman. When transporting a visibly pregnant woman, place padding under her right hip to tilt her to her left side. This position will prevent her pregnant uterus from compressing the major blood vessels returning blood to her heart. Call the hospital. Once all the injured people are safely transferred to a vehicle, notify the hospital about their injuries and the time you estimate they will arrive. Remember, by learning basic emergency skills, you and other bystanders can help injured people before medical care is available.